Hi guys, it's Dr. Langford. I wanted to answer one of the more common questions I get in the office, and that is, what does the color of my urine mean? So generally speaking, healthy urine is a pale yellow or plain yellow color that's clear and you can see through it. There are no significant particles in it. It's not cloudy, and it has almost like a light apple juice color to it. That means that you're adequately hydrated. If your urine is extremely clear, it can be a sign that you're overhydrated. And I understand that a lot of people drink a lot of water for weight loss reasons and for general health, but sometimes you can drink too much. And when you do that, it actually can lower your blood sodium levels, which can be dangerous to your health, can cause dizziness, confusion, headaches, and some serious medical conditions that could end you up in the hospital. So you don't want to drink too much water. If your urine is kind of an orange color, sometimes that can mean that you're a little bit dehydrated. In worst case scenario, it can mean that there are some liver or bile duct issues. So the more orange it is, the more concerning, but just something that you want to keep yourself hydrated and make sure that you check that out with your primary doctor or with your urologist. If your urine is a dark amber or honey color, it really means that you're just not getting enough water. It really is a matter of dehydration, and if you increase your fluids and it clears up a little bit, that really is all you need to do to improve that. Now, if your urine is a brown or syrupy color, this could indicate some severe dehydration. It could indicate that you're on certain medications that can cause that discoloration. And there's even certain foods like fava beans that can cause that. But if it's not something that's easily explained, it could be related to some liver disease. And so if this is a consistent problem for you, you definitely want to get that checked out as well. Now, green or blue urine is extremely rare, but it can be related to a rare genetic disease, or it can be related to some urologic medications we use that contain a dye in it called methylene blue, such as Urabel or UroMP. If it's not related to that, it could be related to some food dye, but it's certainly worth checking out if you suddenly have unexplained blue or green urine. The most concerning urine color would be either pink or red. So there are some simple explanations like eating beets, blueberries or rhubarb, or foods with specific red dyes in them. And there are some medications that can cause this. However, if it's not a medication, we'd be concerned that it's not related to kidney disease, urinary tract infections, or perhaps, worst case scenario, a urinary tumor in the bladder or in the kidneys. So it is a screening test, specifically if we see it in a urine test that the doctor does at the office, or if you actually visibly see blood in your urine. That is always an indication that you should go see a doctor to make sure that everything's okay. Now, most of the time in specifically postmenopausal women, I will see blood in the urine related to the tissue being thin, and that's not a major concern. However, we do always want to make sure that it's not related to anything more serious, like a kidney tumor or a bladder tumor. So I hope this was helpful. One other question people ask me all the time is, how much water should I really drink? And everybody, I think, is a little bit of an individual as far as what they should drink. You should never feel thirsty, because if you feel thirsty, you're already dehydrated. But my opinion is about 48 to 64 ounces a day is more than enough for most people. And certainly if you have certain conditions like heart failure, you should drink less, or what your cardiologist recommends. And if you're somebody who is very on the very dehydrated side, you want to increase your fluids. But it also depends on your activity level. So everybody's an individual, and we certainly need to tailor what you drink and how you manage your fluids to your lifestyle and your activity level. But I hope that the color chart will help you a little bit with understanding what your urine means. Okay, take care. Have a great day.